I see AI as the greatest equalizer. I think that we all have to have that new mindset where we're learning something new like a child. One thing that is important is that when you're learning these tools, never lose sight of the fact that whole human side of it, that empathy is so important. I am a connector, and I think that it shifted my mindset from simple curiosity to just that deep conviction and the understanding that AI, when guided by purpose and empathy, could actually strengthen that human side of medicine. Transformation always starts with a bit of that uncertainty, getting comfortable with the uncomfortable. But the key is curiosity. It's not perfect, and neither is AI. So it's not about perfection.
Welcome to the Transforming Healthcare Coaching Podcast, where we're all about helping healthcare professionals like you create positive change at work, at home, and everywhere in between. Super excited today to talk about what everyone's talking about in healthcare, AI, right? So I'm really grateful for my dear friend, colleague, and local healthcare professional, physician, Dr. Maria Abunto, who is here with us today on the Transforming Healthcare Coaching Podcast, and we're going to get right into it. Dr. Abunto is a consultant, a clinician, and really a connector for lots of people in healthcare. I see her all across LinkedIn, connecting people and making bridges for how healthcare needs to innovate and translate where it needs to go. So thank you so much, Maria, for being here.
Thank you for having me. It's a pleasure. And I love that we have reconnected after all these years, and the opportunity is, I think it's perfect timing. So thank you.
So, Maria, you were chosen as the first ambassador for the American College of Artificial Intelligence and Medicine. And this role was created, I believe, mainly because we're such an important transformative moment in healthcare. Take us back to the moment where you realized that AI in medical education isn't going to go away and it's nothing to be afraid of. And instead, it's something that we need to really embrace and to shape. What made you say yes to be part of all of this with the American College of Artificial Intelligence and Medicine?
Yeah. So it's been a journey. And actually, I believe that the turning point for me was when I realized that AI wasn't something to be feared. It was something that we could actually shape. And so it happened during my executive MBA program in healthcare when I took a course, two courses actually, that completely opened my eyes. I was at the University of Pittsburgh, where I took health information technology as well as the responsible use of AI and analytics. And that was taught by Dr. Narayan Ramasubu. So until then, I thought that technology mostly was a tool. It was used as a tool, something you use to make systems more efficient or analyze data faster. But through these courses, I started to see it differently. I began to see how technology and data could be used not just to improve healthcare operations, but to fundamentally transform how we think about care, how we teach, and how we connect, and also how we serve patients. You did say that I am a connector, and I think that is one of the strengths that I've realized too. And so that realization changed everything. It shifted my mindset from simple curiosity to just that deep conviction and the understanding that AI, when guided by purpose and empathy, could actually strengthen that human side of medicine. And what it could allow is it actually could give us time back, time to listen, time to connect, to practice that kind of deep medicine that technology alone can't deliver. So when I was invited to serve as the ambassador of the American College of AI and Medicine, I immediately said yes, without hesitation. And because for me, this wasn't just about innovation, it actually was more about intention. And I think that was so important. It was about making sure that as AI evolves, human wisdom stays at the center of that evolution. And so I want to be a part of building a future where technology doesn't distance us from patients, but it brings us closer to them. And that's what this moment, right, represents for me.
Yeah, no, it was really important. What, maybe a couple months ago, maybe even a year ago, there was a lot of fear talking in the AI space and skepticism and guardrails and all of these and governance and all these words. And at the same time, I think for a lot of us, it is moving so fast that most clinicians and leaders can barely keep up. And so how does the American College help with that?
Well, it actually raises awareness, but it also what it has done, it actually has brought together, and it's in its infancy, but it's actually brought together thought leaders, experts in the space who have been doing this for many years already. But now it's really coming to the forefront. And these are people, and whether it's physicians, those in healthcare sector, are using this technology, but in a way that has been existing for quite some time now. But now we are actually seeing it in at the end of the consumer side. And so that's what's actually being built out in a lot of what we're seeing across medicine. But as well as this organization is one that we can bring together all of these experts, but it's an opportunity to learn and be a part of that and shaping not only the knowledge, but the education. And then also building on that network is so critical.
Yeah. I think the reality is if you're not learning about AI, then you're already falling behind, which is really scary. And I think it's really also interesting because we have 5 generations in the workplace right now, and it's really interesting to see how each generation is or is not using probably to the capacity or the true understanding of what AI and language models and the training can do, should do, and it really will take up all of our creativity to think about what we want it to do.
Yes. And I think that that's where it's a part of the learning curve. We don't want to leave anyone behind, but this is as educators, this is what's key is to really teach those that, are in medicine or even in higher ed, these people who actually are excited about all that's actually coming and knowing that you actually are an important part of all of this.
Still love, a year ago, I often told ChatGPT or Claude that it was wrong, and it would always apologize to me and then correct as I basically gently taught it what error it had made.
Yes. And so it is kind of learning, right? It is learning from you, but also learning almost to be not so much a twin, but learning from you and your emotions as well.
Right. And so I guess let's paint a picture of maybe what's already happening out there. We know that medical students and residents are already experimenting with AI. They're using it to understand like their complex cases, get a quick teaching point. And they sort of just go ahead and believe what they get back. It's personalizing where they are with their learning. And it's really interesting to use the different tools and the different models that are out there. Different ones behave differently to be able to personalize their learning, to be able to create a learning coach, to create like a podcast, to be able to create quiz bank questions for themselves. What are you seeing that excites you the most about how the newest generation of learners, the students, are using AI?
Yeah, that's a great question because I come from a different generation now. I mean, what excites me most is that how fearless the next generation is. They're growing up in an environment where technology isn't something foreign. It's a natural extension of how they learn and communicate. And they're using AI to understand like disease mechanisms, right, in ways that would have taken us, at least me, months of manual work. And so a lot of these simulations or simulating patient encounters, even that, I'm doing it with all this sense of possibility and not fearful of it. They're not intimidated, but they're curious. And I think that that's what's important is that curiosity will move medicine forward. So it's not about really just mastering the tools, but it's also asking what else is possible. And that's what I find remarkable about this generation and generations to come.
Yeah. I also think that's the most important lesson right now for every student or younger person in healthcare. We have a lot of wisdom as senior faculty, and also you have a lot of wisdom as new students because what you teach us is the curiosity and willingness to play. And so for me, playing around to see what it will do is actually kind of fun to be able to see whether you can question and push And also the other way around, ask it to see whether it can question and push you to become more intelligent, more able to put the dots together for the knowledge. Because I mean, I think that's been the greatest challenger, I think, in healthcare. There's so much to know now.
Is, but you know what's funny is that I see AI as the greatest equalizer, right? I think that we all have to have that new mindset where we're learning something new like a child, right? Who's learning something new with these tools. But that's one thing that is important is that when you're learning these tools is that you're adapting. You also have to be collaborative and never lose sight of the fact that that whole human side of it, that empathy is so important. That's where that curiosity and that compassion that really has to evolve together. And that's where medicine really will truly transform.
So that we can allow us to do our parts, the human parts, really well. And then let the AI do the techie coordination, data mining, streaming, information routing, right? Like maybe someday I won't have to be told that I ordered the wrong CT scan because I clicked on the wrong button anymore. There's something else did it for me.
Even, but that's the efficiency side of it. But then we can focus as physicians, right, on the human side of it where we have more bedside time or time that's more valuable.
So I have to admit, as an educator, there is some interesting work being done. People are trying to think about trying to do things with AI that educators maybe couldn't do before in terms of getting a personalized teaching coach through the AI and giving it guardrails on how much of showing the work that they can do versus personalizing the learning journeys, having unlimited practice scenarios, continuing to have a conversational way to be quizzed across thousands of cases and continue to iterate. And I think the other thing is my fear always is, will it replace the teachers? Will it replace the educators? And how accurate will the assessments be if we use AI in all of these? How do you think AI is going to expand our capacity for developing the teaching and assessment of clinicians?
Yeah, that's a great question. And I think that as an educator myself, that's where AI expands what educators can do in ways we couldn't even imagine a few years ago. You know, we can now create, like you mentioned, personalized learning journeys and how each student can adapt to their strengths or to the gaps or even that pace. So imagine a learner who struggles with one concept and instead of waiting for the next lecture, then they can go get instant feedback, right? They can tailor the resources, but even AI empowered coaching and it meets them exactly where they are. It's almost like a study book. You know, we can give students these unlimited practice cases and also even visualize these complex data systems. So as an educator, I look at it as like having a classroom without walls, the one that's dynamic, one that's inclusive, but also that one that's also evolving. And that's the beauty of AI. It doesn't replace educators. It actually amplifies them. So it gives them more time to focus on what truly matters. So the conversations, the mentorship, but you know, these are moments of discovery. And it's both, right? It's for educators and also the students. So I believe that, you know, what students will remember most is not the algorithm, it's the educator who helped them think differently. And because AI handles the repetition, that's where automation happens, but it's the humans that bring that reflection piece, that meaning, and as I mentioned, that empathy. And so that's where I believe as an educator, that's where the real transformation happens. That when technology take care of the what and the educators will focus on the why. And I think you touched on that briefly.
You know, I also wonder whether the reality is going to be we have a very different metric that we'll end up having to adhere to. Because right now, like having knowledge-based tests may not be the correct way anymore to measure efficacy or competency. And so one wonders, how do we measure truly critical thinking when we are the critiquer and the thought process put together? So if we use AI to get information, but what do we do with that information? And then how do we logic it out? And how do we logic it out with a conversational, generative AI assisted learning coach, plus all of the humans that are also interacting with it? So it is going to be an interesting time and place where what will be the new competencies?
Well, what's interesting too, when you're actually talking about that and how medicine and med schools are now popping up across the country, there's one that, and actually, if you've heard recently in the news, is is it Ann Walton, the owner of the family who owns Walmart. She opened up a medical school free for all. I believe it's in Nebraska. I may have that wrong, but it was recently in the news where the school is called Awesome, AWSOM. So it's Ann Walton School of Medicine. And it is amazing. If you want to look it up, it's actually talking about teaching students, medical students, in a different way and different experiences. For instance, they're even talking about using a garden, the tactile kind of stimulation of knowing, like, okay, so these are things that I have to take care of in the garden. So things like that. So it's that human experience that they're teaching now students, virtual reality, right? Some of those things that they're using as well. So art, they're also using art in the form of a way to express creativity, but how now these new students will be learning these different forms in medicine and to really think across more broadly on just the didactics, right? And the test taking, things like that. So I think that that's where we have to evolve and realize medicine has changed and it is changing, but schools like this is now bringing, issues that have to be, I think, more centralized towards the human experience. It's very cool.
Yeah, so I hear what you're saying too. The reality is, I think the way for the future is because AI will allow us to get information more readily at our fingertips, that we will critique and think out loud to be able to get the knowledge pieces. Therefore, it makes sense for us to think more about how can we be more human-centered for ourselves and continue to have the well-being piece hopefully translate. And I do think the challenging part is that in our workplaces, the question is whether that will follow, right? Because I think in our workplaces, that doesn't exist. And that gets lost at some point in graduate medical education, different from undergraduate medical education.
Yeah, I think AI is actually something that at different levels in education needs to be addressed because it's here. And I think not only the leaders, the educators, even students need to come to the table and actually make sure that we are all aligned, because policies are not standardized, even by state or county, especially here in Pennsylvania. So there's only a few counties that have policies in place in higher ed or even in education. So elementary school, K through 12, right? So I think that's where we need to come together and make sure that not only voices are heard, but there are policies in place, those guardrails.
I think those are really interesting too. My daughter often makes fun of me because she's like, you use AI. Therefore, your quality of work is really not as good as constructing a whole paragraph by herself. And it is going to be interesting because I do think there's going to be some fundamental knowledge that
Yes.
even if you use AI, you still need to know. And I think that's going to be because what if the power goes out? Right. So I think that is going to be an interesting thing as we face moving
Yeah,
forward, is to still making sure that the building blocks can't go away. And it
absolutely.
will be interesting to see how we weight the importance of being blindfolded, would be like if you didn't have AI to help you
Yeah.
and still be able to deliver the care, for example, in
Right.
austere settings or resource limited settings.
Absolutely. And I think we always have to remember that the foundation of all of this is really going back to the basics, right? Not losing that.
And so I guess in transitioning for the healthcare educators and leaders that are listening, that are deans or program directors or coordinators or teaching faculty, this is a really good opportunity that you're going to need to learn something new right alongside your learners, right alongside the students and the residents. And so what does that learning journey look like for faculty like ourselves? How do leaders approach this with curiosity instead of overwhelm or trying to pretend like they know something that they don't?
Yeah, that's true, because I think there's some educators and leaders too who already are feeling that. But I think if you have that growth mindset to be learners again, AI can feel intimidating, but that's okay. Transformation always starts with a bit of that uncertainty, getting comfortable with the uncomfortable. But the key is curiosity. It's not perfect, and neither is AI, right? So it's not about perfection. But we don't have to also master every detail, machine learning or data science, to engage meaningfully. I'm not an expert in that, so I know that is really, for me, it's where I need to really start by asking better questions. For instance, if you're a practicing physician, right? How could this tool help us serve patients better? Or what bias, what might we be missing? who isn't at the table when these decisions are being made? So that kind of curiosity is what fuels progress. So, for example, a medical device or a tool or an app or a wearable, engineers are developing that. Startups are actually trying to push for that to be mainstream. But at that table, sometimes these designs, there's no physician on board. So bringing them in, I think that's key. When leaders are willing to learn and also bring the others in their team, it changes everything. It creates that culture where people will feel seen, heard, and safe to explore, but perhaps even having patients at that table. I think we cannot forget about them, the end users. And I believe, too, that's what trust makes that possible. So different people at the table, it's where that transformation can happen. And just, learning and reading when that, through that change, and it's okay to not know everything, but to be inspired to have everyone learn together.
Yeah. You can definitely see how there's something new in AI almost every single week. And there's only so many news outlets and different ways you can play and different things you can do, different models. And I would say that probably for me right now, the biggest thing is to learn to use multiple different tools. When a new one comes out, just play with it. So I think it's important that as the conversation starts, to engage with your leadership, to be like, hey, you know what? I know I just been sort of like this quiet clinician in the corner, but my voice might matter. And so if there's opportunities to really open and democratize, even in our leadership teams, it doesn't have to be the one IT or health information technology lead, right? Because every group has like a lead that then goes in with the HIMSS people to talk about like what changes are coming down the electronic medical record. But everyone has an opportunity, quality improvement people, research people, educators. AI is for everyone.
It is. And also, we also have to caution that AI can create inequities. I think it is for everyone, but for those maybe who don't have access to even Wi-Fi, for instance, those educators or those people in the rural areas. So we have to think about that too, like medical schools that are popping up in rural Pennsylvania, but the people, the patients that they serve, do they have access, let's say, to their electronic medical health records by using a tool from the health plan or something like that? So we also have to think to the benefit downstream in this whole process.
Well, I guess that kind of leads into my next question. Like, how do we really get practical? So if a program or a medical school wants to begin integrating AI literacy for their faculty and their staff more thoughtfully and responsibly, and they don't know where they can fit it in, they obviously can't just do a one-time lecture and think that everyone's going to know everything. And they also can't tell people go home and just try to figure it out on your own. So what are some of the first building blocks that you think are probably the most fundamental things that every department, system, hospital needs to start with to be able to get people ready? Because this is going to be a progress of learning to get AI ready. What kinds of things do we need to start thinking about if you're a leader?
Yes, and that's an excellent question because that's one that I'm actually working on as part of my research in higher ed. And we're trying to raise the voices of those in Pennsylvania, and that includes students. And so I believe that the way we could prepare students, I think, who will practice medicine for the next 40 years, and half of the tools that they'll probably use haven't even been invented yet. So with that in mind, our responsibility, I always feel, is to go back to the basics as educators and leaders. It isn't to teach them every algorithm or app. There's just so much out there, but it's to teach them how to think. You mentioned that critical thinking. So to question those assumptions, interpret data, but also to approach every decision with empathy and integrity. I have had this conversation with many physicians also who are frustrated, but also frustrated that some of the residents are using it so much that they now, even their notes, it just looks so polished that it is not the usual conversation or that you would naturally see in the notes prior to them using these tools, which is, I can see that would probably help in a lot of the efficiency for students. But then that can take care of that, but we mustn't ever lose sight of the fact that the bedside manners matters the most. Bedside manners and how to teach them. So if you're rounding with them, for instance, that's where they can learn from you as a physician, modeling the behavior. And if it's a family, and how do you speak to the family where the human element remains irreplaceable? Because no matter what comes down the pipeline, all these apps, all these tools, yes, we're learning them at rapid speed, but there's only so much we can learn. But what we shouldn't lose sight of is that human element that's irreplaceable. This, medicine, right? I mean, we've seen it not only in cardiology, but also radiology. These have been around, right? These tools have been around. It's just now it's coming to every household, this opportunity to use it. But it's just ChatGPT is what everybody talked about, but there's so many other things and tools out there that's helping diagnose and treat in medicine. But I think it boils down to really understanding people. Can't lose sight of that, no matter what is out there. Trying to keep up with all these technology, I think that's part of the system. We started with electronic health records, learning Epic, but now there's going to be a lot of other things that's going to be layered on top of that. But hoping it will actually be more efficient, faster diagnosis, faster treatments, getting that treatment to patients. But what will stay constant, though, is that relationship that you would build with the patient, right? That one will never change. That one should always be one that is nurtured and cultivated.
Yeah. So two things come up for me in that example that you give. One is the fact that, well, if you don't like the output, then train the model differently. Because if you do the same encounter with a different language model, you will get different outputs. And so I think the most useful advice I'm currently seeing is that you have to triangulate with different models. So you need to actually try Manus, GenSpark, Claude, Gemini. You actually need to try multiple ones and see how different it is, because then you'll start to understand that the programming on the back end is meant to give you different outputs. And so if you don't like the note, you can just actually request through your IT people, how are we going to make it sound a little bit different? And then instead focus the teaching points to be able to communicate that more effectively with the patient at the bedside.
You've heard of ambient AI, and Abridge is now all over Western Pennsylvania. And that tool is now being accepted at the same time. That's also one that's going to have to be iterated many times. It's going to be, like you said, so you're going to have to output it. You have to change it a little bit and to try to refine it. And then that's what the beauty of that is, that we can do that with these tools that we have now.
Yeah. I remember when Dr. Rao presented the very first prototype so long ago. It's really very neat to see the entire arc now come and just continue to spread. And I think the most important thing is that everybody should get your voice heard at the table. That in your group, there are probably ways to make the case, to make it more customizable to culturally how you speak and how things can be more specific to you. Because we already know that several of the models, you can give the training data sets so that this is how I talk. This is my style. And it's interesting because it makes you start to think about, like in some of the AI writing courses I've taken, it's all about, well, what is style? What is taste? Why do certain passages and construction of certain sentences resonate in a certain way for you? And what is the anatomy? And so it almost gets you right back to like high school and college, where you're thinking about how things are, I mean, again, going back to basics.
Yes, yes. And also knowing that we have our own biases too, right? Whatever model that we're trying to create and some of the calculations or whatever it is, what we're putting in there, it actually could also introduce bias. At the same time, that's where we have to keep refining it, because even the tool itself will have its own biases. So it's something that we also need to be aware of and using it responsibly.
Right. Which is why it's going to be interesting. There really should not be one large player. It's going to be a triangulated multi-model. And I think most of the new softwares that come out often have multi-model behind it so that it can sort of flex to which one seems more correct. And I think that's the most challenging thing, I think, for most end users. People just want an easy fix, and it's not an easy fix. It really is about an interaction with what's happening in some ways. You might find it faster just to do the old-fashioned way for now until it gets used to how you like to do things.
And that's also what really we uncovered too at the conference. And we'll get to that. We'll probably get to that question a little bit later. But that's what part of the learning too as a healthcare provider, right, is to always be not only curious, but ask questions. But be a lifelong learner, because this is going to be changing as it evolves, and to keep up with that. Like you said, Dr. Rao, like many years ago, it was just the prototype, and here it is. Yep.
Yeah. Well, I was just going to ask you, like, so as the ambassador for the American College of AI Medicine, what opportunities are there? What does it offer? And is that the only organization, or
No.
where do we even
Yeah.
start?
Okay, so American College of AI and Medicine, it actually is a new organization, fairly new, and it patterns and it follows basically the same as format, or it aligns very, very closely with American College of Physicians, so ACP. It's where you can become a fellow, you can join, spend at least 2 years as far as being actively involved in the organization to become a fellow, or if you've already been practicing and using AI and producing a lot of research as well as publications, there's opportunities for you to become a fellow. But it's a great organization because it's a time to start as now while it's still young, because you can be as involved as you want to help shape it. And this is where clinicians, educators, and innovators all come together to learn. We had very different specialties representing from radiology, cardiology, family medicine. And what I like most is that you don't have to be a data scientist, or you don't have to be a coder or anything to be a part of this. You just have to be curious and open to learning. We have just a truly interdisciplinary community. And so we're building on that. This was the last conference recently in Chicago this year, brought together about 300 people. What's nice about this too, it's free for students, medical students and fellows and residents. So if you have an opportunity to go next year, and I can send that information to you too, I highly recommend it. There are also opportunities to present a poster, and there's competition. We had people worldwide coming from Turkey, from the Middle East. It was great. And there were, I'd have to say, some of the best speakers lined up, and I was so impressed. I walked away from that going, I probably would have never met them had it not been for this conference.
That's so awesome. Yes, and so I think it is a great equalizer right now, so that everyone has an opportunity. So I actually joined the college. I wasn't able to go this year. I was going to ask, is there, aside from the American College of AI Medicine, are there other go-to resources? Are there any books or podcasts or online courses you recommend to healthcare professionals who want to develop their literacy?
Sure, yes. So there's another organization called American Board of AI in Medicine, and that offers more of like the structured courses that you can actually sign up for. There's a fee for that. And then you walk away with, I think you get a certificate of completion. Other resources, as I mentioned, I took the courses like with the University of Pittsburgh, the School of Business. And so there's courses there. I'd have to say one of the popular ones is Stanford. They have AI learning courses online. Carnegie Mellon University, so that's the #1 school in the country, and if not the world. So I would highly recommend looking at courses there. They have executive education as well for those that are, not able to attend full-time or working and going back to school. That's an opportunity. But I think try to also talk to other people who've taken it if you can in your network. And the podcast that I listen to is called AI Meets Medicine. A very cool one that I also listen to on my walks is called Hidden Brain. You've heard of that? Yeah. And the books, you did ask about books, so I have some here.
Well, actually, that was my last question. My last question is going to be, is what else are you reading aside from ways to kind of get smarter in AI? And like for me, we'll put all of these in the show notes below for people who are listening in terms of free online courses just to get fundamentals. And I totally agree with American Board AI Medicine. It also has a lot of those great resources. And so as we come to a conclusion, Maria, what other things are you reading that maybe isn't AI related?
Oh, not AI related. Okay.
Or it could be AI related. Just, well, what's happy and fun for you?
Oh, okay. Happy and fun for me is actually being able to take walks in the morning before I start my day, listening to podcasts, but also just reflecting on what will be the next step for me, or even during my day, right? What do I actually want to take away from this podcast or my meetings coming up or preparing for other meetings? But the book that I am reading for AI, I just want to show you real quick. And then I have one that I actually was gifted from my sister. So the one that I'm still reading is Deep Med. You can see that by Eric Topol. Oh, and I would highly recommend even subscribing to his newsletter. He's great. I'm on chapter 12 talking about the virtual medical assistant. That sounds really cool. One I think you would like is emotional intelligence.
Oh,
In
nice.
the age of AI, and this is by Bradley Gortson, and I can send all of the information to you. One that I was also given, and I think this one is worth a read, is called The Signals Are Talking, and that's by Amy Webb. It's about why today's fringe is tomorrow's mainstream, so interesting. And then I was gifted this book from my dear sister, and it also has helped me in a lot of ways as far as being more emotionally intelligent, and it's called The Let Them View. Have you heard of?
Yes, we did that on
You
on
did.
our book club.
You
Yes, we are in our
did.
Med Thrive Connect book club. So
I
these
saw
are wonderful
that.
suggestions, and so I can't wait to dive into those.
Yeah,
Thank you so much for sharing all of those. Do you have
You're
more?
welcome. I think, let me see, do I have one more? I said The Hidden Brain, and I think that was, I
Yeah,
think
no,
that's
that's
it.
great. Yeah,
Yeah.
Hidden Brain is a really great podcast.
Yeah.
Yeah, well, thank you so much for coming on and
You're
talking
welcome.
about AI and where we're gonna head in terms
Thank
of this
you.
day and time with being a medical clinician, be able to influence sort of what that looks like, and most importantly, how are we going to shape the teaching and training of our future generations of nurses, physicians, MPs, PAs across the diaspora of the United States healthcare system. So thank you so much for coming on
Thank
and sharing
you.
all those resources. We'll put all of these in the links below in our YouTube channel and in our Apple and Spotify channels as well.
Yeah, thanks for having me.
Thanks so much. And so next time, please feel free to email us at podcast@transforminghealthcarecoaching.com if you have anything you want us to cover. I know you have burning questions. We've already covered other people's requests before. So get on that email. Tell us what you want us to talk about. See you next time. Thanks so much for listening. If you found value in today's episode, please subscribe and share with a colleague who would benefit. Together, we can transform healthcare one person at a time. Find us anywhere you find your podcasts. Ready to take your healthcare leadership journey to the next level? Book a discovery call free at transforminghealthcarecoaching.com to explore our personalized coaching packages designed specifically for healthcare professionals like you.